Hello AP students, this is Mrs. Politsky, and I have notes for Chapter 12, Psychological Disorders, and we're going to talk a little bit about dissociative disorders. So dissociative disorders are a group of pathologies involving fragmentation of personality, in which some parts of the personality have become detached or disassociated from other parts. Examples of this would include dissociative amnesia. Sometimes memory loss is too excessive or too specific to be explained by normal forgetting. In some cases, we might call this amnesia resulting from a severe blow to the head or an automobile accident. However, people may sustain a purely psychological form of amnesia known as dissociative amnesia as a result of a traumatic or highly stressful experience. The memory loss involves a specific event or a series of events, usually a threatening experience from childhood. Dissociative amnesia is a psychologically induced loss of memory for personal information such as one's identity or residence. This is closely related to PTSD. In both cases, memory loss is related to a stressful incident or a period in one person's life. Dissociative fugue. This is essentially the same as dissociative amnesia, but with an addition of what we call flight. This is where we get the fugue side of it. This is usually flight from one's home or family or job, pronounced fugue. Some victims appear disorientated or perplexed. Others may travel to distant locations, take up new lives, appearing unconcerned about the unremembered past. Heavy alcohol use may be a predisposition for a person to have dissociative fugue. It occurs more often in those under prolonged high stress, especially in times of war or other calamities. It is also accompanied with sexual or physical abuse from childhood. Depersonalization disorder. This is an abnormality involving the sensation of the mind and body having been separated, such as an out-of-body experience. So sometimes you might hear about people having near-death experiences. This might fall into this kind of category. Feelings of being external observers of their own bodies, like they're outside looking at themselves. OCD and certain personality disorders often accompany this disorder. People undergoing severe physical trauma, such as a life-threatening injury, perhaps in an automobile accident, may report symptoms of depersonalization disorder. Dissociative identity disorder, or sometimes known as DID. Years ago, this used to be known as multi-personality disorder, but it's a condition in which an individual displays multiple identities or personalities. Most cases appear in women, and most display more than two personalities, though there have been some exceptions to this rule. In recent years, there have been more men diagnosed with this disorder. Probably most noted is former Heisman winner, Herschel Walker was diagnosed with dissociative identity disorder just a few years ago. Specialists now believe that this disorder has always been common but hidden or misdiagnosed. Usually appears in childhood, and its victims frequently report having been sexually abused. The formation of multiple personalities or identities or selves may be a form of defense or defense mechanism by a dominant self to protect itself from terrifying events. DID has become a familiar diagnosis. You might see there's a book called Sybil, also made into a movie, The Flock or Primal Fear. Such emerging personalities contrast in some significant way from the original personality. These alternate personalities each have their own consciousness. They emerge suddenly, especially under stress. The psychodynamic theorist explained it as a fracturing of the ego as a result of the ego's defense mechanisms that allow do not allow energy to conflict with and traumas to escape from the unconscious mind. Cognitive theorists see this as a form of role-playing or a mood state dependency, a form of memory bias in which the events experienced in a given mood are easily recalled when the individual is again in that mood state. Patients may initially be led by suggestive questioning by a therapist who seeks to uncover what they suspect to be repressed memories of trauma and molestation. Dissociative disorder is sometimes called split personality. This causes confusion because, here we go. Because schizophrenia, which literally means split mind, has no relationship to the dissociative identity disorder. Thank you very much.